Did you know that 1 in 20 visits to the pediatrician is for a child with constipation? So stomach pain is obviously very common in kids, but surprisingly, a recent Pedia-Lax study looked at parents of 2 to 11-year-old children and found that 70% of parents report that their child has had at least one bout of constipation in the prior few months. What's difficult, especially in the younger kids, is to understand what their symptoms are. So things to look for obviously would be stomach pain, but also decreased appetite, nausea, irritability, and even bedwetting could be a sign of constipation. Especially during the beginning of the school year, if it's a new schoolroom or a new environment, kids can be shy. They may not want to ask their teacher to use the restroom. They may be reluctant, or they may just be busy and playing with their friends, distracted. They may be a little bit dehydrated if they're not drinking enough water during the day, and they may not have as much fiber as they normally do at home when they're eating the food at school. So there are a lot of different reasons why kids wouldn't want to go to the bathroom during the school day. In general, if there's ever a concern with your child, it's always best to call your child's doctor. You don't necessarily need to go to the emergency room, and there are things that you can do at home. Surprisingly, a lot of parents give their children adult medications just at a lower dose if their child is constipated. And there are problems with this. There is an ingredient in adult formulated laxatives called polyethylene glycol 3350 or PEG 3350. And this may be associated with some behavioral changes or speech problems. So it's really best to take a medication that's safe and formulated specifically for children. And the Pedia-Lax products are the only medications that are specifically recommended and formulated for children with constipation. For more information, viewers can go to Pedia-Lax.com.